From the News Channel 5 network, this is Pharmacist on Call.
Good evening, Nashville, Middle Tennessee, Southern Kentucky, those of you as far west as Jackson, Tennessee, and even as far east as McMinnville. Welcome to Pharmacist on Call. Happy New Year, everyone. This is our first show of 2018, so welcome to your 1 hour forum. The purpose of this show is our service to you. This show, sponsored by Pruitt's Discount Pharmacy, is your 1 hour forum to call in with those questions and those comments that you are unable to ask your pharmacist and your doctor. And let's face it, they're busy. They don't have time, but for this hour, I do. So feel free to call in with those questions and those comments. As we do, we will get into shout outs and condolences. First of all, I wanted to send condolences out to Mr. Hank, who is a cashier at the Exxon Tiger Mart over there in Hendersonville, just off of the first exit there. A very big fan of the show. Wanted to send condolences to him on his wife's passing, and I usually try to get by there and see Hank. So Hank, if you're watching, we're pulling for you, man. So sorry to hear about her going. So also, we wanted to get into some birthday shout outs. We wanted to first shout out my firstborn, my daughter, Shawn Pruitt, who just turned 14 on January the 4th. My first baby, so happy birthday to her. Also want to send a birthday shout out to her cousin who was born the day after on the 5th. My niece, Chelsea Sinclair Thomas, who was actually my first baby before my first baby. And Chelsea, hey, Uncle Shawn will always love you, and we'll make sure we get on that trip. I also wanted to send a birthday shout out to our technician, Miss Ebony Gray, who was born January the 2nd. And you may remember Ebony being on the show, maybe during our anniversary show. She was the young lady sitting to the right of me here. But Ebony, happy birthday! And I just tell you, Ebony, fiercely loyal. She is the pit bull of the pharmacy. While I'm a very nice guy, and some people will come in and try me, she's not having it. She will get you straight. So come correct when you come in the pharmacy when Ebony's there, because she will get you. Also want to send a birthday shout out to my other little cousin, Mr. Maxwell Battle, so my little second cousin there. Happy birthday. And his birthday actually is today, his 15th birthday. So happy birthday, Max. Let's see. Well, it looks like we've got some calls here. So let's get into those first. See who we've got here online. Pharmacist on Call. How may we help you?
Yes, I was calling to see why would it be a question about treatments for curing hepatitis C and waiting on a cancer treatment? Why would the doctor want to know? He's telling me that some of this medication might interfere with the cancer treatment.
Okay, so it looks like that you have a drug that you want to try for hepatitis C.
Right.
All right, but you're also on a chemotherapeutic drug, and your doctor is saying that there may be a clash there.
Okay.
Sir?
Yes.
Okay, so it looks like there's a drug interaction, or is that what's going on? What are the name of the drugs?
He hasn't started it yet. He's wanting to do an ultrasound of the liver.
Okay, so it may be that, which one, so you haven't started either one yet, correct?
Also, I need to get the hepatitis cleared up first.
Okay, so it sounds like the chemotherapeutic drug may be toxic to your liver. And so they'll want to get that cleared up so that the chemotherapy drug doesn't do any further damage to your liver.
Right, it's a Schedule 4, and I was just wondering why he was putting it off and wanting to do so much other studying before he starts the treatment, because it seems like it's a simple thing now. I've done taken a 20-month shot in the stomach for.
I wouldn't want to pretend to guess to get in the mind of what your oncologist is thinking, but I would ask them to explain it to you in depth to your satisfaction, especially since it's you that we're talking about.
Okay.
Yeah. So just ask him, sir, what are your concerns, doc, with me taking the cancer treatment and the hepatitis C drug, and is this chemotherapeutic drug gonna affect my liver? Is that what you're waiting on, or is there some other safety concern that is prompting you to hold up the treatment.
Yeah.
Yeah, I mean, I think that's a reasonable question to ask him. He shouldn't get offended, even though some physicians may have egos, but you're the patient, and we're talking about you. So, yeah, that question needs to be answered.
I'm about to unload a bunch of questions on my next visit. But
you should.
Not too much.
Yes, sir.
I appreciate you helping. That there is going to give me a couple more things to question them about.
Okay, yeah. You should feel comfortable about questioning them, just like you all call in here. I make myself available to you. You should do the same with your doctors.
All right. Thank you.
Yes, sir. Thank you. Dave, welcome to Pharmacist on Call. How may we help you?
Yes, this is Dave Richardson.
Yes. How can we help you?
Yes, I would like to know what's a safe and effective diet pill that you can take that won't hurt your liver.
Safe and effective that won't hurt your liver. Well, the liver would not be so much my concern as it is your heart, because most of the diet pills are stimulant in nature and they can raise your blood pressure. But
Blood pressure.
yeah, but one comes to mind, Garcinia cambogia. And the way it works is it shuts off your appetite, so you don't eat as much. It also blocks the production of fat at nighttime while you sleep. And then it also reduces it's a mild antidepressant effect, so it affects your serotonin levels. So it actually, if you're kind of down and depressed, it picks up your mood so that you're not tempted to binge eat and make yourself gain further weight. And I find it rather safe. So we sell quite a bit of it, won't push your blood pressure up, and should be safe in liver conditions. Do you have any issues with your liver?
No.
Okay, then I would say Garcinia cambogia is a very safe alternative. Now, I caution people if you are on antidepressants like a Zoloft or Cymbalta, then yeah, you would be a great candidate for it.
Thank you so much.
Yes, ma'am, you're welcome. Okay, moving right along. Pharmacist on Call, how may we help you? Pharmacist on Call, hey, how may we help you?
You say Lee?
Lee? Yes, sir. Yeah, I said you. How you doing?
Hey, man. Hey, I called last month or the other month. You wanted me to call back and give a checkup on the Estramax. My wife, I was telling you, she was on I was right. She's on that Estramax, and it's a testosterone booster.
Okay.
Went off to the follow-up 2 Thursdays ago, and he went ahead and took her off that. It was an over-the-counter deal, and we told him about the back hair and, the mustache popping up. He said, I completely understand. He kind of sounded like you, to be honest.
Okay.
But you told me to call back and give you a follow-up.
So, okay, yeah, I remember the phone call. So he took her off of that. Have you noticed any of, like, the hair issue beginning to resolve?
Not really yet, but
okay.
He said it could take up to a few weeks, and
yeah,
we're gonna keep watching it. But I had another question for you though.
Yes,
on
sir.
The over-the-counter drugs.
Yes, sir.
Like I had the flu bug a couple weeks ago, and they had me on the Tamiflu.
Yes, sir.
And one of the neighbors was talking about cutting an onion in half and keeping it in the room to kill the flu and everything. And then they start talking about the elderberry.
Mm-hmm.
And we got some of them gummies. What do you think about the elderberry?
I like elderberry for flu. So if I get sick, I do a mixture of elderberry, hyssop, and I forget what the other one is. But yeah, elderberry, good antiviral. The onion, actually, a raw onion. You cut it open, and for whatever reason, it attracts bacteria and funguses and whatnot. So I say yes. I would say that, yeah, cutting open an onion, but not leaving it in the room too long, maybe overnight, and you'll see that it will change color.
Okay. We did that for a couple of days there, and I don't know if it made any difference or not, but that flu, that's bad this year.
It is, yeah. In fact, I think they were saying that the current vaccine is only 30% effective against it, so, yeah, we've got a rough strain this year.
All right, well,
But yeah, elderberry, good choice.
All right then. Well, I guess that's all I need. I just want to follow up with you and let you know about her.
Okay, then also call in once you, because I want a timeline of when the hirsutism starts to resolve, the hair growth starts to resolve itself, because I want to kind of get a picture of how long it takes, because I'm sure that you may not be the only person that's been affected by it.
Okay, yeah, we can do that. He said it could take a few weeks before we even noticed any difference, but it took a few weeks, before we noticed any difference before it even started growing,
Okay.
It's only been about 6 weeks since, I guess, well, maybe 8 weeks, something like that.
Okay.
But yeah, she definitely still has back hair though.
I would give serious consideration to shave it and then see if it grows back, since she's no longer on the therapy.
All right. Well, you want me to? I ain't really into that.
Well, they have hair removers that you could like rub on the body and wash off.
Oh, okay.
Yeah, so you don't have to necessarily get
she
it.
ain't gonna be able to reach that.
Yeah. Yes, you may have to rub it on for her, but also wash it off so it won't burn her. But at least I would probably start with the mustache, since that seems to be the one that troubles you the most. Okay. All right. Well, I guess Lee's gone. Looks like we are up on a break, everyone, so stay right there. We will be right back.